I'm now being joined on the news by a healthcare practitioner, Dr. Ebuta Agbor, to discuss this contagious disease as it affects the African continent. Thank you so much, Dr. Agbor, for joining us on the news at this time.
Thank you for having me.
All right, so this outbreak of monkeypox, it seems quite scary and to be spreading quickly to countries that are not endemic to the disease. What do you consider as the most troubling aspect of this latest outbreak?
Well, the most troubling aspect would be only for countries that are not endemic. So countries that are endemic, that is countries in the West African sub-region and in the Central African sub-region, who have had cases of monkeypox for years and years on. For example, the first case in Nigeria was reported about 39 years ago. That was in 1978. And then there was a re-emergence in 2017, and that has been on for a while now. And between 2017 and now, we've had over 500 cases. And presently, we have quite a number of cases in our hands. So monkeypox is an endemic condition in the West Africa, in the sub-Saharan African region. So you have it as an ongoing infection. There's widespread significant immunity in the population. So a lot of people are already protected. So for us in endemic areas, it's not an issue. But it's not the same for people in non-endemic areas like in Europe and the rest, where you have high numbers of cases coming up in recent times. But again, for them, the challenge, the bright aspect of the whole story would be that the particular subtype of monkeypox that has crossed over there is the mild form, the West African clade. That particular subtype does not cause as severe infections as the Central African clade. That is one. Then the second thing is that there's a lot of heightened awareness about infection control because we are just coming out of, we're having a de-escalated COVID infection cases right now. So a lot of people are aware. And the third thing again is that this virus is transmitted by direct contact. So you have to have some contact. It's not like the COVID virus where it is airborne. So people have pox, they have rashes, you come in contact with that secreted, with the secretions from the vesicles or from objects that have come in contact with these people. Then to a large extent, you can also develop infection. Another important factor why we may not be as concerned when we compare this to COVID is what we call the reproductive number. That is the rate at which an infected person can infect other people. That rate is about 1.2 or 1.3 thereabout, meaning that one person will infect maybe just a little above one person when it comes to monkeypox. This is as opposed to COVID, where one person can infect 7 people. That is a reproductive number of 7. So putting all of these in context, we would say that we are not going to experience anything close to what we had with COVID. The world is aware, people are aware about public health measures like hand hygiene, maintaining contacts. And then this infection is very visible. You see the pox on the body, it's very visible. And so people
Dr.
are less
Agbor, talking about this heightened awareness, what do you think governments, as much as there are mild symptoms, what do you think government of countries should do that are yet to record cases of the disease to prevent it from spreading into their country?
Well, absolutely. They need to increase their quarantine practices. They need to increase their border control, infection control practices, because the good thing about this is that we know how this thing comes in. It comes in through humans or animals. In fact, in 2018, it was transported to the UK by a pet dog that had come in contact while visiting an African country. So we know that people and animals transmit this. So at the border control, we need to be able to place measures to check people. People with pox, with rashes on their body, people with temperature would probably be subjected to some form of isolation and reassessment to estimate their risk. And apart from that, more importantly, people need to be, more awareness has to be created in terms of hand hygiene and control. The question about vaccination does not even arise right now, although if we get to that point, vaccination would not require large population vaccination. We would use a method called ring vaccination, where only those who are exposed would need vaccination. Let us not forget that in 1980, the world was completely eradicated smallpox was completely eradicated from the world. And the method that was deployed was ring vaccination, where people who were exposed to confirmed cases or highly suspected cases were quickly vaccinated. The incubation period for monkeypox gives us a lot of latitude and a space to intervene if we get to that point, because it takes about 2 weeks to about 4 weeks for patients to develop symptoms. And symptoms are also very classical. You have fever, headache, body aches, and rashes, and patients may also have sore throat. This is just before the rashes will come out on the skin, and the rashes are very, very dramatic. So I think that we do not have a situation where we should be so worried about.
All right, I think, Dr. Agbor, I think this silver lining you put there is at least has allayed some of the fears of a lot of African countries, because when you see the videos, it's quite scary. But now you're talking about mild symptoms and, of course, what the government should do to try and curb this disease from spreading. Thank you so much, Dr. Agbor, for joining us on the news and shedding so much light on the issue. Thank you.
Thank you.